What if I told you there's a technology that can see the future of your health? A technology so powerful it can predict if you'll get a serious illness long before you feel any symptoms and even before your doctor has a clue. It sounds like science fiction, right? But it's happening right now. This is the incredible story of how artificial intelligence is becoming our planet's greatest medical detective. Imagine this scenario. You feel perfectly fine. You go for your annual checkup, and your doctor tells you everything looks great. But silently, deep within your body, a storm is brewing. The very first, almost invisible signs of a disease like cancer, heart disease, or Alzheimer's are starting to appear. By the time symptoms show up and a diagnosis is made, the disease might have already progressed significantly. What if we could turn back the clock? What if we could spot those invisible signs right at the very beginning? This is where AI steps in. It's not about replacing doctors, it's about giving them superpowers. So, how does it work? Think of AI as a super intelligent medical researcher that never sleeps and can read millions of medical documents in a fraction of a second. 2. Uses something called machine learning and predictive analytics. Let's break that down. First, big data. Our healthcare system generates a massive amount of data every single day. We're talking electronic health records, lab results, medical imaging like X-rays and MRIs, genetic information, and even data from our smartwatches and fitness trackers. For a human, sifting through all this information for a single patient is impossible. But for an AI, it's a treasure trove of clues. The AI is trained on this enormous dataset, which includes information from millions of patients, both healthy and sick. Through a process called machine learning, it learns to recognize incredibly subtle patterns that are invisible to the human eye, learns what the earliest whispers of a disease look like in the data. Let's take cancer, for example. AI algorithms can analyze a mammogram or a CT scan and spot tiny clusters of cells that might be cancerous. Sometimes years before a human radiologist could confidently identify them. Stanford University researchers developed an AI that was as good as, and in some cases better than, expert radiologists at detecting skin cancer from images. The AI could differentiate between a harmless mole and a dangerous melanoma with stunning accuracy. It's not just about images. AI can analyze your genetic data to calculate your risk for hereditary diseases. It can look at the text in your doctor's notes and your lab results over several years to predict your likelihood of developing heart failure. In fact, one study showed an AI model could predict a patient's risk of a heart attack simply by analyzing their retinal scans, the pictures of the back of their eye. How amazing is that? Blood vessels in our eyes can hold secrets about the health of our entire cardiovascular system, and AI is learning to read them like a book. Another huge area is neurodegenerative diseases, like Alzheimer's and Parkinson's. These diseases develop slowly over decades, and by the time they are diagnosed, significant brain damage has often occurred. But AI is changing the game by analyzing speech patterns, typing speed, or even the way a person walks. AI systems can detect the earliest signs of cognitive decline. Imagine being able to start treatments or lifestyle changes that could slow down Alzheimer's 10 or even 20 years before it truly takes hold. That's the promise of predictive medicine. Think about the real-time data from your wearable devices. Your Apple Watch or Fitbit is constantly tracking your heart rate, sleep patterns, and activity levels. Individually, a slightly elevated heart rate one afternoon might mean nothing. But an AI can analyze these signals over months and years. Compare them to a massive database and spot a developing issue like atrial fibrillation, a heart condition that can lead to stroke. It can alert you and your doctor to a potential problem long before it becomes a crisis. This isn't just about saving lives, though that's the most important part. It's also about transforming our entire healthcare system. In the United States and around the world, we spend trillions on treating chronic diseases. By shifting the focus from treatment to prevention, we can dramatically reduce these costs. When we catch a disease early, treatments are often simpler, less invasive, and much more effective. This means better outcomes for patients and a more sustainable healthcare system for everyone. This proactive approach is what we call precision healthcare. Instead of a one-size-fits-all approach, healthcare becomes personalized to you. Your unique genetic makeup, lifestyle, and real-time health data are all used to create a health plan designed specifically to keep you healthy. The AI might suggest specific dietary changes, exercise routines, or screenings tailored to your individual risk profile. Of course, with great power comes great responsibility. The use of AI in healthcare raises important questions about data privacy and security. Who has access to our most sensitive health information? How do we ensure it's used ethically and without bias? These are critical challenges that we need to address as this technology becomes more widespread. We need strong regulations and transparent systems to build trust and ensure that these powerful tools are used for good. The AI revolution in healthcare is not a distant dream. It's a present-day reality that is growing and evolving at an incredible pace. It's empowering doctors with insights they've never had before, giving patients more control over their health, and shifting the entire paradigm of medicine from reactive to proactive. The doctor of the future might not just be a person in a white coat or tie. It might be a combination of a compassionate human expert and a brilliant AI partner, working together to see the invisible, predict the unpredictable, and give us all a better, healthier future. We are standing at the dawn of a new era in medicine, an era where we don't just treat disease, we get ahead of it. And that is a future worth being excited about. Thanks so much for watching. What are your thoughts on AI in healthcare? Let me know in the comments below. And if you found this fascinating, don't forget to like this video and subscribe for more glimpses into our amazing future. See you in the next one.